You're hanging out with us right here on the Joint Force. And with us today is Brigadier General Mark Thompson. He's the Commanding General for Regional Health Command Europe and the U.S. Army Europe Command Surgeon. Sir, thank you so much for taking the time with us today. It's kind of crazy what we've got going on in the world right now, and COVID, unfortunately, is on the rise again here in Europe. So what should we be doing to help try and stop the spread?
So again, thank you for having me on. Really appreciate being here. I think the basics of COVID really remain the same as they've always been, and that's really to remember the 3 W's: wash your hands, wear a mask or appropriate face covering, and then watch your distance. And if folks can really rigorously apply those 3 things, they're the best things folks can do to kind of help stop the spread. As we all know and as we're all seeing, COVID is definitely out there. It's going to continue to be out there, and we all have to be vigilant in order to prevent continued spread. We need to pay attention to, the guidelines our SROs are putting in place, and also what our various host nations are saying in terms of their guidelines for containing the spread. And then finally, if you're asked to quarantine or go into a restriction of movement, please take it seriously. You've been asked to go into that status because there's a potential you've been exposed to COVID. And if you break quarantine or you break ROM, you're just kind of needlessly putting other people at risk. So if you're asked to be in quarantine or restriction of movement, please abide by it.
There you go. Yeah, listen to the general. If you are put there, please stay there. Now, sir, people kind of have this tendency, especially in the military. We always kind of think that we're tough, and we try to tough it out when we're sick. But in this age of COVID, do you think we need to rethink that strategy?
Definitely, and you're exactly right. It's really part of our culture that if we got a little sniffle and if we don't feel terribly bad, we're going to come to work because that's what we all do, those of us that wear the uniform. But here in the age of COVID, that sniffle that you have could end up exposing your entire unit and taking them out for an extended period of time. And so we really need to rethink the tough it out strategy in the COVID era. Now more than ever, if you're sick, you need to stay home. Now more than ever, if your children are sick, you shouldn't take them to school. And the COVID symptoms look and act like many of the common symptoms we see with the flu or even the common cold, and the best protection is just to stay home, to protect yourself and particularly protect all the people you work with.
There you go, sir. Like you said, we're all in this together, have to be in it together. That's Brigadier General Mark Thompson. He's the Commanding General for Regional Health Command Europe and the U.S. Army Europe Command Surgeon. Coming up in just a little bit, we're going to be talking with General Thompson a little bit more about trying to get a flu shot this year with COVID going on. Stuff you're not going to miss. Keep hanging out with us right here on the Joint Force. You're hanging out with us right here on the Joint Force, and with us today is Brigadier General Mark Thompson. He's the Commanding General for Regional Health Command Europe and the U.S. Army Europe Command Surgeon. Now, sir, earlier we were talking a little bit about, obviously COVID is back on the rise again, but one of the things that we can't forget about is that it's still flu shot season. So I wanted to ask you, with everything continuing to go on with COVID, is it still important for us to get that flu shot this year?
It is still very important to get the flu shot this year for a couple of reasons. So first, the flu is still out there. It makes people sick. It certainly makes certain people very sick, and that flu shot can really help reduce your chances of becoming ill. And if you do happen to get the flu, the severity of your illness will be much less. But I think even more importantly in this time of COVID, getting the flu shot and that reduction in risk of you being sick or having to seek medical care essentially creates or keeps open medical care for those with COVID. The last thing we really want to see is patients who are ill from COVID having to compete for essentially access to the medical care system with folks who have the flu, when we can prevent much of the folks who would be getting the flu if they just got their immunization. So, we really have to kind of guard the resources that our medical healthcare system has, and I have a feeling that those resources will be very engaged in treating COVID over the next several months, and therefore we need to try as best we can do to reduce the amount of flu we have out there, and the best way to do that is to get your flu shot.
All right, you heard it from the general first. Make sure you get that flu shot on time this year. Now, getting that flu shot, sir, I think it's different every year, but especially this year with COVID, where can I get my flu shot this year?
So you can get your flu shot in generally all the usual places that you can get it. The difficulty this year because of COVID is that our shipments have been delayed. We did get an initial shipment in, and we expect to get our next shipment in the next couple of weeks. But when that shipment arrives, we'll be broadly advertising it across kind of our multiple social media and command media presences to let people know the flu shot is back in, and they can come get their folks can come get their immunization if they haven't received it already. Individuals can always call their clinics or their individual providers, either through phone calls or secure messaging, to get updates on when they should expect the flu immunization to arrive at their respective clinics. It is important to point out at this time that we are fully up on the pediatric version of the flu immunization, so all of our pediatric age patients can come in and get their flu shot at any time, and we have a limited amount of the vaccination that we give to our older beneficiaries, 65 and over, and so I'd encourage those beneficiaries to call their respective clinics to see if that version of the flu immunization is in. But we'd expect for the bulk of our patient population, the rest of our allotment of flu vaccine will be coming in the next couple of weeks, and we really look forward to being able to kind of quickly distribute it once it becomes available.
Well, there you go. You heard it right there from the man up top, the man with the plan. That's Brigadier General Mark Thompson. He's the Commanding General for Regional Health Command Europe and the U.S. Army Europe Command Surgeon. Coming up in a little bit, we're going to keep chatting with General Thompson more about how Regional Health Command is wading through the waters of COVID to make sure that service members and their families receive the best care possible all around Europe. Keep hanging out with us. It's the Joint Force on AFN, serving America's best. You're hanging out with us right here on the Joint Force, and with us today is Brigadier General Mark Thompson. He's the Commanding General for Regional Health Command Europe and the U.S. Army Europe Command Surgeon. Now, sir, we've been talking a whole lot today about flu shots and COVID, and one of the big questions I have for you, sir, is with everything going on this year, how does Regional Health Command Europe ensure that service members, families, and retirees are still receiving the best quality care possible in clinics and treatment facilities all around Europe?
So, great question. So I think, as always, we're really 100% committed to providing the absolute best care, the highest safety and quality to our patients here in Europe. And I think COVID has been challenging for us, particularly with providing enough access for our patients to get the routine and long-term medical care that they've usually been getting as COVID and patients with COVID and all of our efforts to contain COVID does take up a fair amount of bandwidth and access of our medical health care system. But we've really been trying to do several things to expand that bandwidth. So first of all, our clinic commanders and our hospital commanders out there have created a number of very creative and ingenious ways to maximize the use of their staff, to maximize their space, so that we can continue to provide, all of those routine cares that we usually provide for all of our patients. Second, we aggressively, with the first wave of COVID, fell back on our virtual healthcare system and continue to use that. We continue to use that in the period in between waves, and now as we're in the second wave, again, we're converting to a heavy reliance on virtual care, either by phone calls or by phone messaging video systems to allow us to reach the patients where they're at and not have them come into the clinic to receive that care. Certainly, the best way for our patients to find out about how much access we have is to call our appointment lines, and I think they'll find that while there may be sometimes a shortage of face-to-face appointments available, we're continuing to expand our virtual presence so that we can see and talk to our patients, maybe not in person, but in the best way we know how to deliver the care we can. And if a patient requires face-to-face care, we'll get that appointment made. And then finally, especially in this area, the emergency room at Launch Stool continues to be open 24/7, continues to be a place to access for our patients that have acute or emergent medical needs. So we're working real hard to maintain that access, even though COVID certainly causes us to put some restrictions on face-to-face care, and also uses up a great deal of our resources. I think we're still doing a very good job of providing that access to our patients in one form or another.
Awesome. Thanks so much for your time, sir. And before we let you go today, is there anything else that you wanted to add or that Joint Force Nation should know?
So first and always, we really thank all of our patients that seek care from us for their trust in Army medicine and trusting us to provide care for them. And we are always looking for feedback. Love to hear positive feedback, particularly about our providers and the things our providers do for our patients. But we also, if there has been a negative experience of any sort, want to hear about that, either through the ICE system or through our patient survey system, which is called JOES. Always remember, at all of our MTFs, there are patient advocates available. If there are particular issues that a patient needs help working through, whether it's a complaint or whether it's a complex series of appointments or medical care, those patient advocates are great resources for our patients to help them navigate the system. And again, we just want to thank everybody for their trust in us, and we are going to continue to work very hard to take care of and protect our population during this time with COVID.
Awesome. Thanks again for taking the time with us, sir. That's Brigadier General Mark Thompson. He's the Commanding General for Regional Health Command Europe and the U.S. Army Europe Command Surgeon. Thanks for hanging out with us. It's the Joint Force on AFN.